All right, welcome everybody. Glad to have folks join us today. We're going to go ahead and get started. I am Kate Tingley, Director of Marketing here at Infinix, and we're happy to have everyone on today's session. I'm glad to have Randy Boner with us today. Randy is one of our Client Success Managers here at Infinix. Welcome, Randy. Good to have you.
Hi, Kate. Happy to be here.
And today we're going to chat about patient financial verification. So eligibility, benefits, prior auth, patient financial statements, and all of that. And specifically with 2023 coming up, we're going to talk about what you should be including in terms of people, process, technology. So let's jump right in.
Absolutely.
So Randy, why don't we start by, if you can just help us understand, what are the biggest challenges that you're seeing in terms of eligibility and benefits verification?
Yeah, I would say that in general, the timeliness of, getting those patients, verified, getting all their benefits, any type of visit limits, authorization requirements, that type of stuff, getting that done in a timely fashion before that patient comes in, I think is the biggest challenge that I'm seeing. This has to do with staffing shortages, maybe process inefficiencies, or it could just be that you accept a lot of walk-ins and there's not a lot of time to do the patient access process before the patient actually gets seen. So having something in place that kind of enables you to accept all patients, regardless of how much time is in between, now and then when they have their appointment, would really help. So yeah, getting the timeliness down, getting that patient access process done, before the patient comes in is definitely a big challenge that I'm seeing.
A tough thing for practices for sure. What about just patient financial verification as a whole? So prior auth, talked a little bit about eligibility, patient payments. What are you seeing there?
Yeah, so, and I'm sure everyone here knows that patients sometimes don't even know the insurances that they have. They might think they have one insurance, but they have an additional one. They might give you an insurance that they had a few years ago and it doesn't apply anymore, whatever it might be. But definitely with the clients I'm working with, coordination of benefit denials seems to be a big issue. And that really comes down to, verifying which insurance is the patient's primary, which is their secondary. And if you don't verify this at the time of patient access, it will lead to denials in the back end. So I would say, focusing on those coordination of benefits, verifying that at the time of patient access, and I think you'll be in good hands whenever you go to collect that money.
For sure. 2023, it's hard to believe it's right down the road, but what do you see? Like, what is that special sauce combination, people, process, technology? What do folks need to be doing in order to improve patient financial verification and even patient access as a whole?
Yeah, having the right people in place, the right technology in place, and the right process is all very important things. But when you throw into consideration maybe COVID or staffing shortages, stuff like that, you might not have the right people in place, or you might not have enough people in place, or you might have some outdated technology that you've been using that doesn't really live up to the standard anymore. So I think partnering with an organization like Infinix that kind of uses all three. We have the right people on all different levels of the organization. We have the right technology. We can customize any type of integration you might need to kind of just work with your EMR. And that leads to having an efficient process. You don't want to have to do all this additional manual data entry or anything like that. You want to live inside your EMR and you want to quickly send out something that can, enable Infinix to, check eligibility, prior auth, all that good stuff with the click of a button. So I think that's really important, in today's day and age.
For sure. I think as we enter 2023, no one should be doing 100% manual eligibility, prior authorizations. The technology exists. Folks should be for sure taking advantage of it.
Mm-hmm.
You talked a little bit about living inside your EMR. What role do you see integration playing in terms of creating efficient and effective process?
Yeah, I actually think it's one of the most important parts of this. And it comes down to process efficiency. You don't want your employees, if you're already short-staffed, you don't want your employees having to do double manual data entry work. You don't want them to have to go into different portals and whatnot. You want to live inside your EMR. You want all the information to be populated inside your EMR. So I think using bidirectional integrations, HL7s, APIs, it really enables the organization to be as efficient as possible. It really comes down to patient care. The longer it takes for you to, finish the patient access process, the longer it takes for that patient to walk in the door. So if you have the technology in place through an integration with a company like Infinix that enables you to quickly do this type of stuff, everything becomes more efficient and more patients can be seen in a timely manner.
So talked about obviously New Year's coming, and for a lot of folks, this means re-verification, which is obviously a ton of work. So what tips do you have in terms of doing these re-verifications efficiently and quickly?
Yeah, absolutely. And I think every practice, regardless of specialty, has to deal with this to some extent. But obviously, you have patients on the schedule for next year already. I would definitely recommend, at the time of the first of the year to re-verify all the active patients that are on the schedule, make sure their plans are still active, get their benefits, benefits could reset, policies could change, plans could get terms, patients can get new insurance and stuff like that. So doing that verification check at the first of the year kind of, sets you up for success moving forward in the future. And then, as far as getting it all done, because, if you re-verify every active patient on a schedule, that's a lot, it's a lot for anybody to handle, partnering with someone like Infinix could definitely help. But in general, just prioritizing appointments by date of service or even by payer, if certain payers are, more timely than the other, can really help your organization get through the re-verification process in a timely manner.
Good. We see dental groups do that just kind of as common practice. So it sounds like your recommendation is on the medical side, regardless of specialty. It's just good practice to do it at the beginning of every year to reset. So good advice.
Absolutely.
Would love for you to tell us a success story where a client has leveraged our people and our technology to implement an efficient patient financial verification process.
Yeah, absolutely. So, one of our outpatient therapy clients essentially handed over their entire patient access process to us. This included checking eligibility, getting benefits, authorization requirements, all that good stuff. And it really comes down to all three, right? People, technology, and process. And using us, we have all three. So we built an API integration with their EMR to allow them to quickly send us their, appointments before those patients come in for their initial evaluation. We'll get the benefits, we'll, obtain eligibility, any type of visit limit requirements, stuff like that. We get all that information and it populates directly into their EMR. Right where they need it to, because we customize their integration. And then at the same time, if we check that auth is required, that prompts them inside of their EMR to, send us over the initial evaluation notes. So now we can submit for authorization to make sure they always have the authorization on file. This really led to a reduction of the practice's, manual, efforts when it comes to the patient access. They just didn't have the manpower anymore. I mean, that's kind of the status of the industry where, you just don't have the resources that you need in-house to do all of this. So it definitely reduced their manual effort. We improved the accuracy of their eligibility and benefits. We ensure there's always an auth on file when there needs to be. And most importantly, we improve patient care. More patients can be seen because, by using us, they're more efficient. We make sure everything's done before they come in, and they can be seen as many times as they need to.
Great. So we've got a couple of questions for you. What payers do you connect to for authorizations?
We have connections to a lot of payers, and that's through our connections with clearinghouses. We're connected to all the major clearinghouses that you would normally find. And what kind of makes us, separate from a clearinghouse is, even though we have connectivity to the clearinghouse and we do get a lot of benefit, information through automation, we never give you partial benefits, right? So if you work with a clearinghouse, you might get partial benefits for all of your requests, but that's really no good if you still need a team to go in and double check all that information. So, we have certified specialists on the back end to, get any information that the clearinghouse automation doesn't pick up.
I think at last count, we were at over 900, and we definitely got a list that we can send over to you as well, in addition to what Randy mentioned. Do you connect with payers exclusive to Availity?
We are connected with Ability. I don't really have the details on how, what detail we are connected with them, but we definitely have connectivity to them. And we work with Ability all day, every day. So yes.
Yeah. Send over more info on that as well. But as Randy said, we do connect with them. What other questions can Randy answer? Feel free to pop those in the Q&A. As folks are doing that, Randy, I want to ask you if you could tell people one thing, like what is your call to action for them to go home and go into the office tomorrow and do? What should be top priority?
Sure. Now, I think a lot of times, practices have needs, right? And, improving patient access might be one of them, but they might want to test, a certain process out before they really commit to it, or they might try to kind of dabble in it without actually fully going in. And what I mean is, when it comes down to implementing technology, there's always a cost involved, but it's worth the cost. You don't want to do anything, halfway. And if you don't have the technology in place to test what you need to test, it's not going to work out. So if you are thinking about going the route of, having a vendor help with your patient access solution, I highly recommend implementing the technology, API integrations, HL7 integrations that will enable your company to utilize, the solution the best way possible.
Good advice. Couple of more questions. Is there a dashboard for auths in the software, like a working queue? The answer is yes. Randy, if you want to expand on any of that, I'll give you a chance to do that.
Sure. Yeah. So, our solution is very, very dynamic. So even if we go the integration route and, your team doesn't want to live out of two different portals and we set up an API integration, there's still a web-based platform that you can view all the cases at. You can look at all your prior auth requests, all your eligibility and benefits requests. And we also have a very robust analytics portal that all links up to your cases too. So, if you're a smaller practice and, maybe data entry is something that you can afford to do, we have a web portal that you can create cases on, check statuses, stuff like that. And even if you go to integration route, the web portal is still set up and you can go check that and use it as you will.
Does the system track when coverage or auths lapse?
Yes. So the successful story that I told you, we set up certain mechanisms within the EMR with our API that tracks visit limits. It tracks authorization, units or visits. So there's notifications that get sent out whenever there's like, okay, this patient only has 2 more visits on their authorization. You might want to submit for a new one, stuff like that. So those mechanisms can be customized and built to your needs.
And one more question that admittedly, I don't know the answer to, maybe you do, Randy. Do we integrate with Salesforce?
I've actually been hearing more and more about integrating with Salesforce. Currently, I don't know if we ever have yet, but I've been a part of a few calls where we've, evaluated it, and it looks like we can do it. So, I think an API would be the way to go there. In the lab space, I have one client that is looking to integrate with Salesforce. So I definitely think it's doable through the API.
Historically, Salesforce is focused on kind of the B2B and not done a lot in healthcare, but yeah, we're certainly seeing them move more and more into the healthcare space, particularly the provider space. So good question. That's all the questions I've got for you, Randy. It doesn't look like, does anyone else have any other questions? Oh, there was one more that I missed. Do you all integrate with Home Care, Homebase, or NextGen or Brightree? NextGen is a yes. Brightree or Home Care, Homebase. Are you familiar with those, Randy? I'm not.
Home Care, Homebase, I'm not familiar with them. But I mean, everything I've been a part of, we can, set something up with, I've been talking about API or HL7 integrations. Those are the most common. But maybe an integration like that doesn't fit with your EMR's capabilities. We have bulk upload features where, you can essentially extract your schedule, upload it to our system. We can build some bots to kind of automate that process. There's a lot of different ways we can automate, parts of the data entry, which can really help your staff out. So it's not just the API or HL7 integrations. We actually have a long list of ways we can integrate with you all.
Yeah, lots of options, for sure. All right. Well, thank you, Randy, for your time. We will reach out to you, Crystal, to get answers to any of your questions that we said we would do some follow-up on. And yeah, thanks again, Randy, for joining us. Have a great evening, everyone, and we hope to see you back here next Thursday.
Absolutely. Thank you all so much. Have a good one.
Thanks, everybody. Bye-bye.